So there's so much that we can do that isn't based on drugs and surgery that you may not have heard about in school. And the curriculum is so jam-packed. Yeah, well, maybe there's room for something more. There's room for online courses there, such as we teach, PBM Prima. And, there's room for a creative approach that doesn't necessarily have to teach you as much about areas that you are not destined to focus in. Because, yeah, there's a lot more species to learn in vet school than med school. But aside from the board exam, I never had to know anything about diarrhea in a pig, and don't really care to. So anyway, in terms of PubMed.gov and online shopping, don't forget that, because that's always happy to do. Acupuncture therapies and neuroplasticity. So I just searched for acupuncture and neuromodulation. Here are some of the things that I got, but there's endless amounts. And so when I talk about neuromodulating the brain, spinal cord, peripheral nerves, autonomic nervous system, and myofascia, all that has this rich scientific support. No woo-woo, just rational mechanisms of action and published evidence. So neuroplasticity, changes on the human cortex induced by acupuncture therapy. This is even years ago now. This is very old. Acupuncture modulates resting state connectivity in default and sensory motor brain networks. So this is just a piece that I just chose a few examples for the effects on the brain. And so how nice it is to be able to perform neuromodulation, so working with the nervous system circuitry without having to cut things open. I did this during my neurosurgical medical student fellowship while I was a med student. Cut open the back, cut open the spine, get a neuro pacemaker, neurostimulator, insert it there right over the spinal cord, and then you have these wires coming out, and you have a little doodad, and you just change the signaling of the spinal cord. People have done this kind of thing for urinary or fecal incontinence, implant stimulators into the sacral region over the nerves to make them fire. There's no need for that. We can do this with acupuncture and related techniques. So it's just so much more fun. With this acupuncture-based neuromodulation, we deliver a clear signal or a group of signals to the central, peripheral, and autonomic nervous systems as a means by which we impart rational, systematic approach, as I've said, resulting in more efficient and more effective improvements in our patients. So we're not dilly-dallying with, the tongue, the pulse, eliminating wind, moving out dampness, getting rid of the demons that have set foot in that poor patient's realm. So we're dealing with concrete structures, objective endpoints, measurable effects. So Maine, medical acupuncture and integrative neuromodulation acknowledges and addresses the complexity of the body-mind landscape needing to be soothed, strengthened, and restored. And that gets us as well to psychoneuroimmunology, so internal organ function and dysfunction. So it's not just orthopedic stuff, it's not just neurologic stuff, it's how the body is organized and how it maintains function based on respiration and cardiac function and GI function, distribution of nutrients. I mean, all that is involved, and all that responds to the acupuncture treatments that we might use to target the brain, the spinal cord, the peripheral nervous system, the autonomics, so the sympathetics, the parasympathetics, the autonomic innervation of the vasculature, the myofascia, connective tissue, all of those things that we can intervene with to make differences not only in them, but how they work with each other, how the nervous system affects muscle function, how it affects the circulation, as we've said, and how when an area is jammed, when we can palpate that and we feel those tight areas, that's not only creating some discomfort there, but think about all the lymphatics that come through here, the vessels, the arteries, the veins, the different ligaments, the vagus nerve, the sympathetics, all those things. Oh, it's not just neck pain. It's a whole big pain there. And then range of motion, ability to just sleep because you're neck hurts so bad, and also blood flow to the brain, blood flow from the brain. Just like I showed in the initial picture, we have so many different layers to our being that it's nice if you have a physician or a veterinarian that is acknowledging all those different layers to your being and being able to address any problems with dry needling, with electroacupuncture, photobiomodulation, and soft tissue manual therapy. So with acupuncture, for those of you that have studied acupuncture, here's more specific information. So if we're going to address the brain and spinal cord, how do we speak to that with our acupuncture? Well, we want points that strongly influence brain and spinal cord function. And we will go into that, but think of that, the governor vessel and the bladder line over the spinal cord and into the brain, and especially the inner bladder line, but also the outer bladder line, speaking to all those spinal nerves coming off. That is delivering a clear, strong signal to the central nervous system about what you want to achieve. Where have issues arisen? Where is maybe the spinal cord sensitized? And we want to help neuromodulate that down. So we want to have winding down of that spinal cord activation. Peripheral nerves, points that follow the acupuncture channels of that particular involvement. If it's a pelvic limb lameness, like in the stifle, what channels go into and around that stifle area? But we're not going to be stupid and just focus on the painful part, the thing that's glaring us in the face. We're going to think about the antagonistic and agonistic effects of muscles on if it really is the cruciate, or even if there's any kind of pelvic limb instability, if there's stifle problems, we're going to think about the hamstrings, because the hamstrings are a cruciate agonist versus excessively overfunctioning quads are cruciate antagonists. So if we know that, if we've layered and scaffolded that information in as well from like a rehab course or from our acupuncture course, I include that as well. But the more we know about the synergistic functions of muscles, the antagonistic things going on, then we can selectively activate certain areas that might be inadequately activating. The autonomic nervous system, because we want to affect blood flow in area, lymphatic drainage. We also can use stomach 36 in the situation of a stifle problem to give its parasympathomimetic effects and count on that as having some analgesic benefits, because we're going to get more endorphinergic influences, we're going to get anti-inflammatory benefits. And so we have local, regional, and system-wide effects with our autonomic nervous system changes that we can impart with the main approach. And then, of course, the myofascial findings, because we're going to do a complete exam and not only just feel around that joint if that's our area of concern, but think about the iliopsoas, think about the whole pelvic limb, think about the opposite limb, think about this limb, think about the head, think about the neck, everything. So we need time to do that, and a curious mind that is interested in that. So that's where we're going. And those myofascial targets of pain are what we're looking for and finding. So to do the protocol that I'm describing, that I trademarked and developed over my lifetime, what you need to know: cranial nerve structure and function. If we're going to deal with problems of the head and neck, then we need to know, well, where are our, with the Boston accent, where are our access, John? No, let me try to get, where are our access zones, if you can figure that out. So cranial nerve structure and function. Where are the foramina that are transmitting branches of the trigeminal nerve, of the facial nerve, of the vagus nerve, spinal cord segment relationships, peripheral nerves and organs? So brachial plexus is from the caudal cervical spine to the T1, T2 region. So anytime we're going to be treating a forelimb problem, we can think about the central nervous system piece as being in this region, cervical thoracic region, whether we're going to go for the ventral nerve roots or the dorsal nerve roots. And there's rationales to both, because the ventral nerve roots are what are creating that brachial plexus that is then going to the limb. Sympathetic and parasympathetic nervous system anatomy. Quick review, we know that the parasympathetic cell bodies are in the cranial and sacral regions, and the sympathetic cell bodies in the spinal cord are in the thoracic and to the mid-lumbar region that will differ according to species. So if we're treating, for example, urinary incontinence, then what's the control based on neurophysiologic effects of the bladder and the urethra? So how do we determine when we're going to pee or not pee? That's from the sympathetics here, parasympathetics in through here, somatic aspects here, cognitive aspects, pontine micturition center. Peripheral nerves, going to be tibial nerve. So it's just the more you know about anatomy and how things are orchestrated in terms of getting things done, even, sitting here doing this, even having my eyes open like this, moving my mouth. There's all this orchestration happening simultaneously. And if something goes awry, then we have to figure out, well, where was that problem? Where did it happen? Is it central? Is it peripheral, facial nerve injury, or whatever it is? Identify trigger points, taut bands, referred pain patterns. We've talked about that a lot. So when it comes down to actual treatment strategies, if we have something like an orthopedic concern, wherever that is, let's say it's the shoulder, what's the central piece? Well, I just told you that the brachial plexus comes out of that cervical thoracic region. We talked about that central piece, whether it's the ventral rami or the dorsal rami from those spinal nerves. Peripheral, we're going to do our palpation. We're going to figure out what channels are involved. We'll have significant acupuncture points along there. Autonomics, what are some neurovascular hotspots, really influential regions in the thoracic limb. LI10, stomach 36, we could go for just general stuff. Kidney 3 and bladder 40 for pelvic limb problems. Myofascial aspect, we're gonna know that there is this extensive connective tissue contribution to shoulder pain, if that's what we're thinking about. We're going to think about mobilizing that scapula. How is that attaching to the neck, and how is the neck movement, all that. So that's, for example, how complex it gets with something like shoulder, but it's doable. And it's not flailing about thinking about stagnant chi and channels. It's actually going there, and the fact that we know that we want a central, peripheral, and autonomic piece to this, as well as the myofascial piece, means that we're going to look for those things. So it's a bi-directional thing where it makes us better doctors because we're doing better medicine, because we're doing better physical exams, and we're doing better histories. Internal medical issues. Oftentimes, we'll think about gastrointestinal. Central piece is going to be thinking about those spinal cord pathways that are contributing their sympathetic splanchnic nerve relationships to that internal organ thing. So digestive, if it's inflammatory bowel disease, you're going to tell me if I'm wrong ever throughout your lifetime. If you do palpate animals with inflammatory bowel disease, I will be so surprised, and I will question you and not believe you if you say that you didn't find any problems in the lumbar region of that animal. Peripheral nerves, we're going to go along the spleen and stomach channels, which will also double for autonomic input. And then palpation, again, you're going to have back pain with a lot of these internal GI things. Of course, GI by definition is typically internal, but as we treat restrictions in the soma, then we're going to lessen that load of nociceptive input into the cord, and we're also going to address viscerosomatic maladies here, and we're just going to feel better. And I mean, if they're constipated, for example, and they have disc disease or back pain, they're not going to be able to poop as they should. It's going to hurt, so they're going to not do that, and then you have problems. Craniofacial conditions, that's where we want our cranial nerves to be known, where they exit the skull, triple heater 17 for the facial nerve, stomach 2, trigeminal, everything here is trigeminal for its sensory involvement. But for the central piece, GV and bladder points along the head and neck. Peripheral points, we might choose large intestine 4 because of its crosstalk in the cervical spinal cord. It's a master point for the face and mouth, but why is that? So as we come up here with the radial nerve, there's going to be crosstalk between inputs into the spinal cord for that and that trigeminal nucleus coming down into the cord. So we can use peripheral points in the thoracic limb for that. We might use stomach 36 as an overall parasympathomimetic effect. Autonomics, we get those as well with large intestine 4, liver 3, stomach 36, kidney 1, all that. And then Palpation, if it's dry eye, we're going to certainly go around the eye. Be very careful in the dog because there's no full, complete bony orbit. And we're going to help modulate circulatory supply to the eye because we have this whole ring of anastomosing vessels with arteries and veins around. There's so much we can do with the cranial nerves, stomach 1, gallbladder 1, triple heater 23, bladder 2, maybe some massage of bladder 1. We have yin tong here, GB 24.5. Oh, he likes that. Look how much he likes that. Oh, that's a good spot. That's a good spot for kitties and doggies. And even us. Try that on yourself. Nice. Craniofacial conditions. And then neurologic input on immune function. What are we going to do there? That's going to be a sympathetic disturbance. Large intestine 4, GV14, LI11, stomach 36. So points that have a lot of rich sympathetic nervous system investment and connections, and GV20, that and stomach 36 have these parasympathomimetic effects. All this, so it goes on, but it doesn't mean that any of that is beyond our reach, because we can understand how the body works actually, realistically, rationally, and target points. We don't have to do all of those points that we've just gone through all at once, but we have a way that we can triage what will be most effective, what seems to be probably a good approach, a tolerable approach. We don't want to scare these animals. We don't want to put them in, these certain ways that you see maybe in other countries that they might just have them there and they're stuck there and you're doing all this heavy duty electroacupuncture on them. No, we want them to be very comfortable. We want to do mechanoreceptor stimulation. We want to have specific frequencies with our electroacupuncture that are either endorphinergic or system-wide. So all that is part of what we talk about in the medical acupuncture for veterinarians course. And then the photomedicine piece, again, as I said, if we're adding something, let's say for wound healing, we're going to want to use wavelengths that are better for surface treatment. Or if we're having disc disease or spinal cord injury, we want wavelengths that penetrate more deeply. So that's with our photomedicine courses and also the acupuncture course. So I've presented you today just sort of an overview of the non-woo-woo approach to acupuncture, because it doesn't have to be woo-woo and it shouldn't be woo-woo. It should be based in science, which is what we do. So if you're interested, if you haven't already taken the course, or if you're not already enrolled, it's our course, Medical Acupuncture for Veterinarians. And we have lots of new changes and opportunities for learning despite COVID-19. So we're not going to let that stop us, because we have a job to do, and that's to change medicine for good. So thank you for joining us. And as usual, if you have any questions, info@CuraCore.org, or you can email me directly, Narda, Narda, @CuraCore.org, and visit our website, CuraCore.org. Thanks for joining us today. We'll see ya.